Doctors/therapist of Reddit, do you have any, no, that's not normal, stories? If so, what abnormal habit/oddity did the patient have thinking it was normal? Not a doctor, but I had an experience like this with someone I slept with. We had just finished and were cuddling when he remarked that he was happy he felt like he was in his body. I looked at him funny and asked him what he meant, and he said, you know that funny feeling you get after where you feel like you're not in your body? You're like looking at yourself from the opposite side of the room? Well, right now I don't feel like that, I feel happy instead. I tried my best to not look horrified, and I asked him if it was always like that for him. He explained to me that it only started happening after something awful happened to him 2 years ago. I had to do my best to gently explain that no, I do not get that funny feeling, and most people don't. I also had to explain, to the best of non-professional capacity, what disassociation was. Edit, just wanted to clarify that me being horrified was out of genuine concern for his well-being. I was worried he was raped or something horrible, not judgment for having any sort of mental illness. Guy in his 20s came in complaining of belly button problem. I examined him. He had an irritated scab inside the belly button caused by aggressive lint picking. But dude was sweaty and had a slight tremor. Looked like crap. When I asked how he was feeling overall, he said, oh okay, I guess. Just a little tired, drank a little more this week than usual. Probably overdid it. I had to pry for details, and turns out he drank a gallon of gin over the last 3 days and stopped drinking alcohol when he started vomiting large amounts of blood and pooping a mixture of bright red blood and dark sticky stuff, melina digested blood. He was totally unaware of the fact that he was going through alcohol withdrawal, sweating, shaking, because he hadn't stopped drinking long enough in recent memory to experience symptoms. I sent him straight to the emergency room, where they found a tear in his esophagus that required immediate intervention, and he was admitted for inpatient alcohol detox. I read his hospital note. He still insisted that the ed doc examine his belly button. 50-ish-year-old man who came in for chronic issue follow-up. He brought his wife with him this time around. At the end of the visit, she says, hey, tell the doc about that thing you can do. He turns to me proudly and tells me that he can whistle from his. If he really pushed, he could blow gas from it. His wife insisted it wasn't normal, but he was certain most guys could. Turns out, he had a connection between his bowel and his bladder. Mom brings her kid in because the babysitter was concerned about these spells the child would have. Apparently, the child would have episodes where he would just blankly stare at them and not acknowledge whatever it is they were telling him, or whatever he was doing. The parents just thought he was being an and not listening to them, or being absent-minded. Kid turned out to be having absence seizures. A younger gal who had come in for generalized abdominal pain that she experienced on and off for years, but just always wrote off to either menstrual cramps or bad food or life. We had asked her if her bowel movements were regular, and she said yes. At some point, someone was sharp enough to ask her how often she had bowel movements, to which she said, about once every 2 to 3 weeks. She had been suffering from pretty severe constipation, but just thought it was normal to have BMS once to twice a month. I'm sure I have more, but I think I wrote enough for now. Ninja edit, oh yeah, I have a lot of stories involving skin lesions. Please people, no doctor will ever fault you for wanting to just get something looked at. There are a few easy ways to tell if you're looking at something potentially evil. Gotta amend the above edit due to people's bad experiences. No decent doctor should blow you off if you're concerned about a skin lesion. They should at least take the time to discuss why it is they're not worried about a lesion, if it's not concerning. Thank you for the reassurance about doctors. I'm always afraid that they'll be thinking, really? You didn't know what this was? Thanks for wasting my time with nothing. My pleasure, smiley face. Any doc who treats a patient like they're a waste of time for something concerning is a real piece of work. The fact of the matter is that there are a lot of manifestations for skin cancers, and some lesions that aren't skin cancers can be signs of other things going on in the body. No one has ever been killed from a simple shave or punch biopsy, but those simple procedures sure as hell has saved a bunch of lives. I was the patient, but when I went in for a routine physical, the doctor poked my extended belly and asked how long it had been like that. I laughed and said, "What? My beer belly? Oh, since I was 21 probably." Turned out that, no, the beer belly was a cyst that had grown really large, and that was why my friends kept saying I looked pregnant. I thought I just had really friends. Had to have emergency surgery, and for a week or so there did not know if it was a cyst or ovarian cancer. It was a pretty big scare. Believe it or not, this also happened to me. I found it because I became pregnant and they saw it in the ultrasound. Also had to have an emergency surgery, and I lost 32 pounds that day. I always just thought I gained weight weird or something. 32 pounds? Holy. I was the patient. I had no idea that it wasn't normal to uncontrollably sob for 2 weeks out of every month, have breasts so sore I couldn't go downstairs, jiggle, and then have it all stop the day you start your period. It took me getting a female roommate at 30 for me to realize that wasn't typical. I asked my OBGYN after charting my symptoms for 6 months. PMDD, a depressive disorder that is tied to your menstruation. A change in birth control pills fixed it right up. He also looked at me like I was crazy for thinking that was normal for 16 years. I asked my mom after my diagnosis, "Oh yeah. Remember in high school? Your friends would come over and ask if you were crazy that day or not." "No, Mom. They didn't ask me that." "Thanks for letting me know. I have PMDD too. I didn't realize how crazy I was until my husband forced me to go to the doctors at nearly 30 years old, been on Prozac ever since and feeling a lot better." I feel like my story belongs here even though I'm the patient, since the exact scenario happened to me. A few years back my mental health totally took a skydive. As a result, I dropped out of school and had to start a recovery program. The first thing I had to do was talk to a psychologist. During these conversations with the psychologist, she'd focus on different parts of my life. So one day she'd ask about relationships, and the next, childhood memories, and so on. After a few conversations she focused on my social life. I then told her that it's pretty much non-existent, and it always has been. She then stated that I must have suffered from loneliness a lot then. I just told her that I've never actually felt lonely at any point in my life. After all, it's pretty hard to feel lonely with the two voices in your head always keeping conversation. But surely she knew that, right? Well, as it turns out, no. Apparently everybody else only have their own voice in their head. My entire life has been a lie. Turns out I'm schizophrenic. Who TF knew I? Fellow schizophrenic here. I was 9 when I heard my first voice, a hill on the school playground named Tracky, and 12 when the girls came to live in my head. I didn't question it. They were my friends, and where they came from didn't much matter at first. I really can't pinpoint the origin of my schizophrenia. I've had the voices as my companions for as long as I can remember. I don't remember much from before the age of 11 or 12 though. However, I know that I've always been bad at socializing, and I know that loneliness never bothered me. So the schizophrenia could very well go all that way back to my toddler days. I can't be 100% certain though. This was a time I was told something I did wasn't normal. I was in physical therapy recovering from a back surgery. My in-home physical therapist was having me do stretches and asked me to extend my leg as far as possible and straighten my knee. So I do this and my knee inverts, which to me was totally normal, but my PT was very surprised. She explained that was very abnormal and she had not seen hyper-flexible knees like mine before. So now I know my wonky bird knees are not normal. Edit, it has been really great to find others who are also hypermobile. No one else in my friend/family group are like this. Edit 2, I've added an illustration of what a hypermobile knee joint looks like for those curious. http://imager.com/bayoki. Fixed link. I've had this with every medical professional I've told about my hypermobility. For example, I dislocated my finger at the knuckle and then popped it back in. I was telling the doctor and they were like, "You can't have done that," and they tested the range of mobility in my finger to show it would be super swollen and immobile if I had done as described. I told the doctor I can usually bend my finger way more than that and explained I was hypermobile. Doctor, oh yeah, show me. Me, bends arm to show hypermobile elbow joints. Doctor, oh my god. Stop. Obligatory, I'm the patient. I thought for years that I was just continually getting more and more out of shape. Despite my best efforts, Nothing helped. I would just hit this wall and couldn't keep going. Eventually I couldn't walk from my driveway to my house without needing a break to breathe. Turns out shortness of breath isn't just something to wave away, it's also something I wish doctors had taken seriously. In the span of 2 weeks, I went from seeing a local clinic PA to being admitted to the ICU. My doctor told my husband he had no idea how I was still alive, nevertheless functioning. This was me with my heart problems. I literally thought I was just lazy and out of shape but never improved despite me trying to work out more. Turns out I had literally been in heart failure my entire life. It eventually quickly tanked to the point I needed a transplant. Now I feel like a freaking superhuman because I can exercise without feeling like I'm dying.